Good morning, good afternoon, and good evening, ladies and gentlemen, and also students. Thank you all for being present at this keynote presentation at TUFH 2021. Time flies so fast, and today will be our last keynote session in the last day of TUFH Conference 2021. My name is Camila. I'm from Indonesia. I'm a medical doctor and also the upcoming local team manager of SNO. Today, I will be moderating this keynote session with Veda and also Heru from Gadjah Mada University, Indonesia. It's an honor for me because today our keynote speaker is Professor Janet Grant. I pay my best respect to Professor Grant. Well, today's session theme is very interesting and maybe it can be the answer to overcome medical learning in this pandemic era. Professor Janet is an educational psychologist and director of CENMEDIC, the Center for Medical Education in Context, and also the FAMER, Center for Distance Learning in London. For most of her academic life, Prof. Janet conducted policy research in medical education for the UK government and professional medical and regulatory bodies. Her interests are in policy research, educational development, continuing professional development, and also curriculum. She has written extensively on contextual relevance in these topics. CENMEDIC runs an international distance learning master course on accreditation and assessment in health prevention education for the US Foundation for the Advancement of International Medical Education and Research, or FAMER, and also in Keele and University Medical School in the UK. Her center also developed and managed SCIE 59, the online psychometric specialty choice inventory, and the online diagnostic thinking inventory. Prof. Janet has been a regulator in both medical education and legal education. She has chaired the development of the 2020 WFME standards for basic medical education and also the 2021 WFMA standards for distributed and distant learning. Well, now I invite you to listen to her presentation on distributed and distant learning in medical education, the World Federation for Medical Education Standards. Well, you may ask your questions and or provide your comments in the chat function below. Please note your name and country in the chat before asking your questions. Professor Janet, you may start your presentation. The floor is yours.
Thank you very much, Camila. That was wonderful. I don't recognize myself at all. So let me just find, oh, no, that's it, not it. Find my presentation. So I was asked to talk about distributed and distance learning. The World Federation for Medical Education, as you've just heard, sets standards, and we take a great deal of care in doing that. And our standards for distributed and distance learning will be published by the end of next week. They've taken more than a year to develop. So I had the pleasure of chairing the group that did that. I've got a special interest in this area. I'm an educational psychologist by training and an elected fellow of the British Psychological Society. And I direct, as you've heard, a big international distance learning master's course. I also, for the government here, planned a distance learning medical school, an entire distance learning medical school, which is possible. We worked with 11 ordinary medical schools to plan this. It has not been done for various reasons, but it was approved by the General Medical Council and by our government. So it is quite possible to teach medicine at a distance. And you've heard, I've established distance learning programs in medicine in the UK, in India, in Bangladesh, and in various other places. So arising from all of this, and from my 35 years at the Open University in the UK, which is the first and I would say best distance learning university, where we teach every subject except medicine and veterinary science. So 35 years of working in distance learning has enabled me to understand how this works. And on the basis of all that, and because of the recent events, WFME was continually asked about distance learning. And so we decided to write those standards. So it was that COVID focused attention on teaching students who are away from the central campus. And what we found was, well, what I knew was from reading what people were writing and papers that they were publishing and questions that we were getting, that there's a lot of confusion about what distance learning actually is. So we needed to look at these issues to see really what confusion we needed to address in our standards. What happened to with COVID was that it made schools focus on technology-based teaching methods. So on library resources, internet resources, virtual lectures and seminars and tutorials, simulations, videos, but mainly on learning packages, on the conversion of what happens normally to what happens in the new circumstance, demonstrations, self-assessments, virtual reality, all these things are possible and have been used. But COVID has caused more reliance on these existing resources. I don't think that COVID has actually caused anybody to introduce anything that is actually new. It's simply a rebalancing of the way in which people teach. So that's an important issue. My presentation has now stuck, which is interesting. But these various things are just teaching methods. Like a lecture is a teaching method. Reading is a teaching or learning method. So these are all just teaching methods and nothing more. It's just online learning. And online learning is not distance learning. So when people converted what they were doing into a different format, they simply converted the way of teaching. And what we noticed was that they didn't do anything else. That's not distance learning. Online learning is not distance learning. So what changes actually happened? Well, students are often no longer located in the same place. They are distributed. Therefore, there was a conversion of curriculum elements to virtual or technology-based methods, but much of that was happening already. And this gave rise really to what we've called a conversion and delivery model, which was appropriate as a short-term firefighting response to a crisis. It was absolutely the right thing to do. But, as I've said, schools didn't usually change anything other than the method in teaching and perhaps in assessment. So that was, although a huge amount of work, actually quite a minor change. And I am impressed looking around by the technical development of teachers and schools. But I am worried that those technical developments and that the conversion of elements into a different delivery method may be embedded without thinking any further. And if that's the case, that would be quite dangerous to the quality of medical education. So the question now is whether or not this short-term firefighting response of just converting different elements is what we've got at the moment, just a short-term change. But schools might think about changing their identity in the long term. If schools decide that what they have done in the short term seems to have some positive effects, and therefore they would like to continue doing this in the long term, then there has to be a different planning, implementation, and quality assurance process around it. So schools must adapt their planning, their design, their resource allocation, and their management to distributed learning. That's learning where everything is distributed. I'll come back to that. So if this is going to be a long-term change, then the school itself must change, not just its teaching methods. So the school must have a local presence. It must appoint teachers who are near to the location of students. It must set, I've got two T's, it must set up regional branch offices of that school for meetings, for study, for academic advice, and so on. So if this is going to become a long-term solution to a problem, the whole school must change, not just the teaching methods. And that won't suit all schools. Some may wish to revert to their previous formats, and you will hear in a minute. I hope that schools do revert to their previous format. I would not want schools to embed permanently the things that they're doing now. So I called this distributed learning, and the WFME standards are for distributed and distance learning. So my definition of that is that distributed learning is where learners are away from the central institution. The school incorporates facilities and staff near to the students to deliver that curriculum. So the school is distributed as well as the students. And that is how the Open University works. So learners are supported by central and local teaching staff. And those local teaching staff are supported by the central institution. So there's a rich variety for the student of virtual, technology-based and face-to-face teaching and learning methods and assessments. And that is what distributed learning is. It is a managed whole systems approach. It's not just the conversion of teaching methods. And distributed medical education is something that actually happens already. There is a central medical school with everybody and everything in it, but you also use hospitals with teachers, with experience, with facilities. There are sometimes in those hospitals local study centres and resources. There are community and rural facilities, very often even further away, again with supervisors, with teaching experience, student support, assessment methods, and so on going on there. So you already have in medical education the basis of a distributed system. But if this becomes the dominant identity of a medical school, then you have to change the way that medical school is managed. So on the basis of all this, we wrote the WFME standards for distributed and distance learning, and you'll be able to get them next week. And these set out the conditions for distributed learning. That's effective for teaching, learning, and curriculum delivery. That is a long-term development that is well implemented, effectively managed, and quality assured. Distributed learning has to have all of those characteristics. And these standards were written by people with extensive experience of distributed learning. I think I read about 150 different articles in writing this, but I knew most of it anyway. And we had wide consultation to ensure clarity and relevance. And I know that some of you responded. Thank you very much. And this, with WFME, will be supported by training and consultancy and so on. The WFME standards are principles-based. They're not prescriptive. They do not tell you what to do. We will never tell you what to do. They will ask you and guide you in developing your own local design and making decisions about that. So we've set out the design areas and issues within them. And then we give key questions and guidance that will enable schools or regulators to consider the application of this in their own context. So rule number one is this: forget everything that you knew about fashions. Medical education is a fashion-based industry as far as I can see. Forget everything you ever knew about fashions in independent, self-directed adult learning. Forget all of that. Distributed learning is highly controlled for very good reasons. It succeeds when you take the student through a defined learning pathway and keep them there. If you lose a student at a distance, you will never get them back. So it has to be that highly managed, organized process where it's not, the dropout rate is huge, and the period of time it takes is a long time. So you have to manage it. So forget everything that you knew and start thinking about how you manage the whole process. So what must be designed and managed? Well, the character of distributed and distance learning is something that the standards set out so that you know what sort of thing that you're aiming at. And then within that, you have to look at course design, course production. Distance learning, distributed learning, is a huge production and management process. You have to look at assessment, student support. Students need more support at a distance. Academic and clinical staff, they need more support at a distance. And the key to it all is a management office, course management, and quality assurance. So our standards look at all of that. The question really is, does any medical school actually want to do that? And in a talk that I'm actually giving tomorrow somewhere else, we're going to be thinking about whether there's a revolution in education. I hope there is not. I really hope there is not. Just changing delivery methods isn't enough. That's not a revolution. If schools choose to stay with distributed learning, you need to think about whole systems management, the effective use of those distributed locations, student support, teacher support, quality assurance, and the key to it all, academic management. So how is this distributed learning different from traditional learning? Well, obviously, the students, the school, the facilities, excuse me, everything are distributed, everything. This is not a central organization beaming things out. It is a distributed organization. Of course, there's central planning and management and quality assurance of the distributed system. There has to be oversight, but the actual school has to be distributed. There is a different balance of technology-based, face-to-face and group learning. Nothing new, just a different balance. And probably a different balance of formative and summative assessment, greater support for teachers, greater support for students, and a central role for academic management and records. So I've now said all these things about 3 times because these are the important elements. I would say, however, that when you convert materials for distance learning, they must be designed in a completely different way. They have to be designed in a way that ensures that students continue learning. And there's a lot of knowledge about this. In the Open University, we have a huge amount of knowledge, for example, about how you keep a student turning a page in print-based materials, and students actually like print-based materials. Technology-based learning is very difficult to keep your eye on. It gets very dull, it gets mesmerizing, it makes your eyes hurt, and the quality of feedback is usually pretty awful. So technology-based learning is really not the great thing that some people might say that it is. And I would also say that a lot of people say, well, you know, this new generation of young people who grew up with technology, they know how to use it. Well, quite frankly, I know how to use it and I'm old, but they know how to use it for game playing, for WhatsApp, for messaging, for quickly picking up their phone to find out something. They're forever picking up their phones. I'll just find that out. They are not used to using it for learning. That is a completely different thing, and it's really not that effective. So do not be seduced by these strange arguments about these young people and technology. So, and this is what I'll be talking about a lot tomorrow. Will COVID revolutionize medical education? So what I'm saying here, and what our standards actually are saying, is be careful. Be very, very careful if you think that your conversion is all that is required, or is even necessarily in the long term the right thing. I hope that after all this is over, we return to what we had before and continue to think rationally about how to develop that, and only to change it if there is an actual problem that you have identified, not because there's a fashion, not because you think that somebody somewhere else is doing something, because normally they're not anyway. So current medical education has huge strengths. Medical education also has necessary content that must be taught. Basic science, clinical skills, assessment, you have to have clinical experience. Medical schools all differ. There is a glorious range of types of school, from very traditional ones, which truly can be excellent, to ones that are quite different from that in the way in which they do things. I won't say innovative, because mainly schools that say they're innovative are just copying what someone else does. Medical schools differ according to their mission, their context, their problems, and that requires contextual development. There is not one solution. There are local solutions to problems that you have identified. And if you haven't identified a problem, don't make a change. Development should occur in response to a problem, not in relation to fashion. There is an ethical issue in changing education. Think about it in the way in which you would think about introducing a new treatment or setting up a clinical trial. You wouldn't just do it because you thought, oh, that'd be interesting. You have to go through ethical approval. I think educational change should go through ethical approval as well, because there's no robust evidence to suggest what innovations you should adopt. There is none. So unless you have an actual problem, don't change. If you have a problem, do something rationally and ethically. And that suggests rational development, not a revolution because of something that's happened in the world, some awful tragedy that has happened and is happening in the world, and you have had to make a response to it. And finally, some advice. Never change unless you first identify the problem and plan an appropriate path to address it. That is what's happened over the past period. You identified a problem. Students suddenly had to go home, and you made a response to that, and you started teaching them at a distance, and that was wonderful. And I am so full of admiration for that. But that was a response to a short-term problem. It's not a new era, and it mustn't be a new era. education is not a fashion statement. I keep saying that, but it has become that. Oh, everybody's wearing blue today. I must wear blue today. Everybody's wearing a shorter curriculum today. I must wear a shorter curriculum today. No, you don't have to. Any colour is good. Any length curriculum is fine if it's what's right for you. Always put in an evaluation, a programme evaluation, to track the effects of the change you make, because there is no evidence base to help you decide what changes you should make. There is none, which is why part of the ethical approach to educational development is to put in an evaluation, track what effect this is having. Never assume that students are natural online learners. They are not, because they're just humans. Their brains work in the same way as ours. Everybody's brains work in the same way. They cannot concentrate any longer than we could. They get bored with looking at the screen just as we do. They like to have a pencil in their hands and something physical to do just as we do. They like to be able to go backwards and forwards fast as you can in a book, and you can't on screen. And they really don't like it when the screen just freezes. So never assume that they're natural online learners. They are not. So use traditional and new educational methods. And as I have said, support and management are the key factors in all of this. If you're going to change your teaching methods, fine, just change the odd teaching method and do that in a rational, planned way. But if you're suddenly going to change a lot of it, you have to think about the whole system, about management, about support for students, and about support especially for teachers. In all of this, what I've noticed is that we think about students. Of course, we should think about students, but we haven't thought about teachers. And we know that they have had a terrible time. They have been working their socks off, trying to do something that's new, unusual, that nobody trained them for, that they're confused about, and they are dedicated to that task, and they've been amazing. And I would say, revolutionary statement, that if I was putting in distance and distributed learning, I would first support my teachers. So it's more than just changing teaching methods. Thank you.
Wow, thank you for the remarkable presentation, Prof. Janet. Could we give a big round of applause for Prof. Janet? I'm gonna give one.
You don't know how to do that.
Well, I know we are all excited about this theme. So without further ado, we're opening the questions and answer session. So you have anything to ask, please ask in the chat function. You can find the chat function in the toolbar, and please note your name and country before asking. We have a question actually from Berg Attingen. Oh no, sorry.
You just said something very nice. Thank you.
yeah. All right. Oh,
And
from Berg
somebody here
Attingen.
has also, can I just say, somebody here has also mentioned the Northern Ontario School, and the Northern Ontario School of Medicine in Canada is definitely a place to look at, and they have really tried to distribute the entire function, so they certainly should. I would love to see a distance learning medical school in the way in which we planned it for our government. If anybody wants to do that, come to me. I've got the plans.
Well, the doors are opened. So the work Attingen asked, I am wondering if these standards were published.
So the standards will be published. They are now completely finished. I actually finished the very final draft yesterday. They should be up on the WFME website within a week. So it may be sooner than that. So keep your eye on the WFME website, and you'll find them there. But I'm sure that Prof TT will also, I mean, she will know when all of this is coming out. So I'm sure that she will let you know as well.
All right, we're looking forward for it. So I personally like this distributed learning concept. It focuses on learner to learner as well as instructor to learner interactions. So Prof. Janet has just presented how distributed differs from the distant learning. Well, we've been familiar with the terminology of blended learning, right? So Professor Janet, I want to ask, how does the distributed learning differ from the blended learning, actually?
That's a brilliant issue to raise. Education is a social science. That means because we don't have much research, we invent terminology. So you have to be really careful. There is hardly any agreement about terminology. So, and it all overlaps. So blended learning is normally thought to be a mixture of face-to-face and technology-based learning. That's what people normally think that it is. And you do that in a planned way. Well, distance and distributed learning, obviously, is a form of blended learning with lots of additional features, such as students being completely distributed and the medical school being completely distributed. So when you're studying education, don't feel that you have to really understand it in the way in which you understand a natural science. Just make sure that you know that terminology is very fluid, that the ideas are what's important. Define your terms, and you'll see that everything overlaps, because, as I say, we like to look at things from different angles, think up new terms and publish those terms because we don't have any evidence. So that was a really good question, and they overlap. There is a good deal of proper planned blended learning in distance learning. There has to be.
Okay, thank you, Prof. Janet. I think Prof. Titi wants to ask and want to discuss something.
All right, thank you very much for the opportunities. First, my questions, so we cannot replace clinical experience with online simulated or virtual learning?
No.
Okay.
Absolutely not. One thing that in our plan, remember that distributed learning is about distributing the medical school. And in the distance learning medical school that we planned, and the plans are here on my table, we mapped the entire healthcare service in England, actually. And we said, where could we put groups of students? What clinical experience does it offer them? And how can we train and support local clinical teachers? So no, you cannot teach practical skills without practicing practical skills. But what you can do is to do that in a distributed way.
Okay, just one more question. So if nobody knows when the pandemic COVID-19 is over, if it's become a prolonged condition like this, so what will you suggest? Do we have to, again, change the whole education systems towards distributed learning?
Well, I think that, yeah, what I would do myself, because we don't know how long this is going to take, and it would be a dramatic change to reconstruct your entire medical school, unless you wanted to do that, say, for 15 years or something to make it worthwhile. So I would say that you have to decide for yourselves. Either you have to say, to set up a distributed medical school would be a good idea in itself. We are going to do that, and we are going to do that seriously, and then read all the WFME standards and do that. You could make that decision, or what you could do is the other thing that I was suggesting, which is to evaluate what you're doing, identify problems, and those problems might be about bits of the curriculum that are not being delivered. It could be about anything. It could be about poor student experience. It could be about poor student outcomes. although one of our students is just actually looking at better student outcomes that are happening over the past period rather than poorer student outcomes. It could be anything, and then solve those problems in a rational way within the structures that you've got, remembering always that management is at the back of it. So you've got two choices. One is wholesale change, if you think this is going to go on for 10 years or 15 years, which we know from previous pandemics it might. Or you can say we're going to take a rational approach to development, look at the problems that we have, look at the overall vision that we have, and change things rationally, piece by piece, within a greater plan. I would probably, if it were me, I don't run a medical school, thank goodness. If it were me, I would probably change things rationally within a wider plan. But if you want to change it to a distance learning medical school, ask me and I'll do it with you.
Thank you so much.
Thank you, Prof. Titi. Really brilliant question and also answer. Looks like we got several questions coming in. It's from Mazin Mohammed from Sudan. Thanks for a nice presentation. Prof. Janet, do you think that online learning is the next future method of learning instead of traditional way of learning? How can we implement in low-income country like Sudan?
Right, great question. No, I do not think that online learning is the future. Absolutely no. It is simply another option for teaching and learning methods. There's really nothing special about online learning. It has been so highly marketed. There's a lot of money in it. People want to sell it to you with all these ridiculous arguments about, you know, Generation Z or whatever it is now. You're probably beyond Z. I don't know what you are. So no, this is not the future. It is simply another option. And I would say in Sudan, yes, you can have distributed learning. But where you have the sorts of resources and communications and distribution in a huge country like Sudan, you design your distributed learning appropriately for that. And a lot of that would not be technology based. It would be based on print. It would be based on resources. It would be based on local study centers, and it would be based on big management from a central place. I think that a country like Sudan is actually ideal for distance and distributed learning because it does not depend on technology. Stop thinking that online learning is distance learning or that online learning is the future. Neither is true. So yeah, Sudan could definitely do distributed and distance learning. And you do not have to have massive resources to do that. You have to have the skill to design it.
All right, thank you, Prof. Janet. I think we have Prof. Gandis, who has just raised her hands. Please, Prof. Gandis.
Thank you very much. Thank you for great talks, Janet. In my opinion, one of the challenges for distributed learning is how to standardize the process among the centers, including the facility, including supervision, and many other things. Any suggestion for that?
Yes, absolutely. You are totally correct in what you say, which is why we emphasize, and we've just published a paper in Remote and Rural Health in Australia that talks about this, which is why we emphasize that if you're talking about distributed and distance learning, you have to think mainly about two things. One is supporting your teachers, but the main thing is management. You have to have an academic management center. Even our little distance learning course, it relies entirely on the management. It doesn't rely on, you know, ideas about teaching and learning and all that stuff. It relies on management. And I can say to you without a shadow of a doubt, because I've worked in all of this, you can manage it to ensure the standard assured quality across the entire system, because you're absolutely right in this question. This is part of the ethical issue that surrounds distance learning. You can't have a good experience here and a bad experience there. It's all about management. Education is all about management. But really, you can do this, but you have to put in your quality assurance systems, your teacher support. You have to keep in, you have to have all your data being gathered all the time. You have to have feedback systems, and you have to have design. So yes, with management, you can do that, definitely.
Can I say a word?
All right.
Moderator,
Please, Dr. Cabra, you may say.
I'm so glad, Janet, you brought this, that distance learning and this today's virtual learning are very, very different, number one. And it is not for always for future, because this is what people are thinking, and without going into depth of it, many people are thinking. So we need to be very clear about that it is one of the options. But what do you see now in what we used to do and what we are doing during the pandemic? Where will be the sort of merging? What will come out over the time now? Thank you.
Yeah, that again is a really,
Prof. Janet,
really
I'm
great.
sorry, due to the time, can you make it quick?
Yeah, that's a great question. I hope that one thing that comes out of this is a better understanding of how to use individual teaching methods. That you can't just, put something on a screen, a lecture, have a few MCQs or something. There has to be design that goes into these methods of teaching, a lot of design that's based on what we know about how students learn from them. So I hope that, that the design of those individual methods comes into it, but after that, nothing much changes.
All right. Thank you, Prof. Janet. Thank you, Dr. Cabra. I'm really sorry there's floating of questions in the chat function, but we have to say sorry because the time is up. So, Prof. Janet, are you willing to answer it personally if the people ask you personally?
Oh, of course. Yeah, absolutely. If anyone wants to get in touch with me, I'm always delighted. Looking at the questions, I think the answers are all there, actually. Yeah, if anyone's interested in this, do get in touch, or you can get in touch via Prof. TT, whatever you want to do.
Yep, you may, please. Well, it's been a pleasure with all of you in the past 3 or 4 or even 5 days for the students. Thank you all. On behalf of the committee, we hope that this conference will leave a good impressions, strong network, insightful knowledge, and of course, happy feelings. It's not the end yet. We'll see you in 15 minutes because we're going to have another scientific sessions, another oral presentations. So, towards unity for health. Goodbye, everyone.